Today we are speaking with ENT specialist Dr. Annabelle Leong from ENT Care Clinic to understand how advanced vestibular assessments can help identify the cause of these symptoms and guide personalized treatment. Dr. Annabelle, can you briefly explain what the vestibular system is and why is it so crucial for our balance?
Well, Eileen, the vestibular system is part of our balance system. The balance system actually consists of the big boss, the brain, who then oversees all the team players, which namely includes both your eyes, the inner ears, which is called the vestibular system, the nerve endings in your trunk, your abdomen, and your legs. So essentially all these team players, they feed in information to your brain, and your brain coordinates all these different stimuli to then allow you to understand where your head is in different dimensions, in time and space, even when your eyes are closed. The vestibular system is very important. When things are working well, we feel very stable and balanced. But when it's completely disrupted and working abnormally, then it can lead to strange symptoms like feeling kind of imbalanced, falling over to one side. You may get vertigo, which is like a spinning episode or an illusion of the whole room spinning around you, and unsteadiness. Even people tend to get floatiness and swaying sensations too, and lightheadedness. And many people in Singapore tend to describe all these different symptoms as a very vague giddiness. So in essence, the vestibular system is very, very important in our everyday life, and we just don't understand how important it is until something goes amiss.
So what are some of the most common vestibular disorder you see in your practice?
Oh, in our busy ENT practice, we see many dizzy patients, but the most common one has got to be BPPV. This is a benign paroxysmal positional vertigo. Essentially what this means, benign means it's self-limiting, but it's a very annoying, however not a sinister condition. Paroxysmal means that it's an intermittent, on and off kind of nature, and positional means it's triggered by certain head positions. For example, if you accidentally tilted your head to one side, the left, it may trigger off BPPV. And BPPV is a condition where calcium crystals in the inner ear become dislodged accidentally. And then they fall off from their usual place here in the inner ear to fall off into one of these little rings called the semicircular canals. And this stimulates the balance organs to behave abnormally or incorrectly. So that's the most common condition that we see in our clinic. The next most common condition that we see here is probably vestibular neuritis, and this is an inflammation of the balance nerve, which commonly affects many people in Singapore. And some of them have often just suffered a bad viral infection like the common cold or the flu. In such cases, patients tend to complain of an imbalance or feeling as if they're just not stable and have an inability to walk straight in a straight line, and they may find they fall off to one side. They may also then develop a floatiness or swaying lightheadedness sensation. If you were to go on to what's next down on the list of common balance conditions, I would say perhaps Meniere's disease is a common inner ear condition that we find here in our clinic. And this is an inner ear condition. We think it's probably autoimmune, meaning some antibodies would attack the membranes of the inner ear, leading to the classical 4 symptoms, where people tend to get fluctuating hearing loss, a fullness or blocked ear sensation just on one side, vertigo, and also tinnitus, which can be an annoying noise in your ear. What is difficult for us to tell the difference in the clinic is how we can differentiate between Meniere's disease and another condition just as common called vestibular migraine.
That's really interesting. What are some of the symptoms that someone should consider vestibular assessment?
I think anyone who's suffering recurrent episodes of vertigo, dizziness, especially if it's positionally triggered, imbalance when walking, especially if you have difficulty maintaining your balance in a dark room or in a dimly lit area, if you have persistent nausea as a secondary event from your dizziness, or if you have any other more worrying symptoms such as blurry vision, headaches, then yes, you should most definitely consider seeking a specialist opinion from a vestibular expert.
Okay. And are there any other symptoms that would need urgent medical attention?
So these are what you call red flag symptoms, and these include a sudden hearing loss or a sudden blocked ear in association with your dizziness. If you have any difficulty walking and you have imbalance just to one side, if you suffer double vision or blurry vision, a slurring of speech, facial numbness, or weakness. If you get a weakness or numbness on one side of the body, including your arm and your leg, then you should most definitely seek an urgent medical opinion, as this may suggest more serious neurological issues and require immediate assessment.
Okay, so what can one expect during this test?
So the vestibular system, usually we would assess this clinically in the clinic. For more challenging, complex or revision cases or recalcitrant dizziness cases, we would sometimes then think about doing a kind of a battery of vestibular testing. So it's more comprehensive and hopefully more objective too. And the two most useful kind of vestibular tests are the V-HIT, the Video Head Impulse Test, and the caloric tests. And these tests basically look at the vestibular function of one ear. And usually it feeds us information as to which ear might be affected and also how severe it might be.
So Dr. Annabelle, once you are presented with the test result, how do they guide the treatment?
I think the V-HIT and the caloric tests provide very detailed information for us to determine which side or which inner ear might be the one at fault. So for example, in a patient who has suffered vestibular neuritis, inflammation of the balance nerve, they're often left with, for example, a left-sided vestibular weakness. So the calorics in the V-HIT would then be used to provide information to confirm the left vestibular weakness or dysfunction. And then this would give us the right information to plan the proper vestibular rehab therapy for them.
And why is early vestibular assessment so important in your opinion?
I think that once you suffer an acute vestibular problem, the earlier you seek a medical opinion, then the earlier you're going to reach a good diagnosis, so that we can then prevent falls, which are a major cause of injury, especially in the elderly. It also prevents many patients from seeing too many doctors from various specialties, as well as having to stay on vestibular sedative medication like Stemetil or Cineron, often prescribed by the GP or family doctor. I've had many patients come to seek our opinion, and they have usually seen as many as up to 10 doctors from different specialties, ranging from cardiologists, neurologists, other ENT colleagues, and even psychiatrists. And some of these dizzy conditions have been going on for so many years that the patient gets increasingly confused, and many dizzy patients, sadly, they have often developed secondary anxiety disorders. So the earlier you seek vestibular assessment, the better it is for you, because once a diagnosis is confirmed, then the earlier you can start treatment to optimize your recovery.
Right. And what's your advice to people who may be living with dizziness or imbalance?
I would say that they shouldn't give up hope, and they should seek help early. Don't ignore it and just dismiss it as aging, because dizziness has many different causes, and many of these causes are often treatable. So the earlier we can identify the cause, then the earlier we can help you return to your normal activities. Because ultimately, what most people are troubled by is that dizziness affects your quality of life. If you're struggling with dizziness or imbalance, don't wait any longer. Vestibular assessments are the very first key step towards understanding what's wrong and getting the right care that you deserve.